Today I hope to be able to share with you some of the more in-depth things that we've been thinking about when we think about the kidney and the gut. And I'm definitely not a specialist in GI disease, but I work very closely with my colleagues who specialize in GI disease, and we've recently done a lot of very interesting work in this area. So I want to present to you today thinking about this particular connection between these two organ systems and what this could mean for our patients. What can you take back to the clinical setting to determine how we better provide health for both the gut and the kidney and how the two are actually interrelated? And so in human medicine, there is actually this concept of the gut-kidney axis. Again, it's the concept that kidney disease, when it becomes very abnormal, can actually affect gut health. And gut health, in reverse, can affect the health of the kidney. And this is referred to as the gut-kidney axis. One of the very first things that I want to talk about is diagnostic challenges associated with that. And probably for elderly cats, one of those biggest things is weight loss. And whether or not we can say that the weight loss is actually due to chronic kidney disease or other concurrent disease like GI disease. So when we think about what that looks like for the particular patient, anytime you see that patient losing weight, I have to ask myself the question, is it actually the kidney disease or is it that concurrent disease? And this is Frank. He was one of my patients. And Frank had started to lose weight, and his kidney values had started to increase. So the question we have to ask ourselves is it just the kidneys? Do we treat the kidneys? Do we need to look for other disease processes? And you can see, in fact, that here for Frank, once we diagnosed or started to better treat his kidney disease, he actually gained weight. That's the blue line on the top. And in fact, his kidney values improved. We didn't find any other diseases for him, but it's important to look at this moment and ask yourself the question, is there another disease process that's happening? And actually, simply by stabilizing his kidney disease, we had a good clinical outcome for several years. So it's important to realize that with kidney disease, we absolutely see weight loss. And this occurs in many different stages of kidney disease. It occurs in early stages and late stage. We more commonly think about late stage kidney disease as being associated with weight loss, but actually when you look at data like this, even in the earlier stages of disease, we absolutely have weight loss. And this study showed that up to 3 years before diagnosis, we can see that weight loss happen. So that really presents a problem for us when we're thinking about our patients, because along with weight loss, very commonly comes muscle loss. And so you have this very muscle-wasted patient. They're losing weight as well. And this affects creatinine, right? So when we have a decrease in muscle volume, the creatinine, which comes from muscle, will falsely go down. And that will affect your ability to actually be able to diagnose that kidney disease. If you also have GI disease, you could be getting weight loss from that as well, and it might hide the fact that you have chronic kidney disease. So when we use things like SDMA, this would be another test that tells us about kidney function that is not affected by weight loss. Those types of tests can also help us determine what is happening with the kidneys. Do we need to be concerned about those kidneys? Another big area that we do actually focus on in kidney disease is proteinuria, and thinking about whether this is renal proteinuria and we should treat it, right? Because we know that proteinuria is associated with progression. But it's very important to remember that proteinuria can occur for a variety of reasons, and we need to make sure that it's not from some other infection or inflammation in the body. So you do have to take a look at that whole patient and say, is there inflammatory disease like GI disease that would be causing proteinuria? I want to address that first before then saying it would be due to the kidneys, and I should then be giving an anti-proteinuric therapy. So going back to Frank, I originally gave his case as an example of when we get kidney disease, but if you can look at his numbers, Frank did well for some period of time, but then he actually did develop GI disease, and he started to lose weight again, and his creatinine started to go back up again. So then we identified that he had GI disease, and we started treating him with diet and with steroids, and again, his numbers stabilized. The creatinine came back down again, and his weight was better. And actually, eventually, he died of some other disease entirely. He didn't even die of his kidney disease. He died of cancer at the ripe old age of somewhere in the 20s. So it is really possible for us to get a good effect clinically if we can stabilize each of the kidney and gut processes that we see and make sure that we get the best clinical outcome that we can. The other big thing that, of course, happens with GI disease that could affect the kidney is vomiting and diarrhea. That makes perfect sense, right? But that is not a good thing for our patient with kidney disease. Those water losses will, of course, make you dehydrated. And when you have kidney disease, you don't have a good ability to regain those losses. Additionally, if you're a female cat, you might be more prone to urinary tract infections. And of course, then if they have diarrhea and they're not able to clean their hind end properly, especially if they have osteoarthritis, we do often see those problems in our clinical patients. So we're not getting the calories in that we need, we're having water losses, and none of those things are good for the kidney. So that's a very common example of how the gut could adversely affect the kidney. And of course, the really big one is nutrition. Nutrition is so important for these patients, right? And when we have chronic enteropathy and chronic kidney disease at the same time, we have a significant concern for being able to get calories into the patient. First of all, they don't feel like eating. And second of all, they don't absorb those nutrients very well. So if we can address that chronic enteropathy or that GI disease and help them absorb their nutrients better, and then also address their difficulties with appetite, we will hope to get a better clinical outcome. And so one of the things also to think about with GI disease and kidney disease is iron and anemia. So in our cats with kidney disease, we of course can have anemia. And when we treat the anemia, we often give an iron supplement. Well, this study that just recently came out demonstrated that it makes sense that if you have GI disease, you're more likely to have iron storage problems. And then also low cobalamin, right? So if I have a cat who has both of these diseases, I'm probably more likely to have anemia. I'm more likely to need iron to help treat that anemia. And also, I would have low cobalamin, and I would want to treat that as well. So those are things that I'm even paying more attention to in that patient population. And then, of course, because cats like to collect diseases as they get older, what about hyperthyroidism? Let's add yet another disease onto the pile. And if we have hyperthyroidism in addition to kidney disease and chronic enteropathy, then we have a very confusing clinical picture where they're losing weight, they may have diarrhea, you may not have good absorption of your medications for hyperthyroidism. That's actually very common in our patient population. So again, by targeting the GI disease, I will help these other organs. I will help my kidneys. I will help the management of my hyperthyroidism. So that's something that's always going on in the back of my mind. What can we do? Well, when we think about the therapeutic approach for chronic enteropathy, I mean, of course, I could give an entire lecture about that in itself, but here it is just on one slide. We absolutely think about, when we have that patient with that patient with weight loss doing the workup for chronic enteropathy. And then here's just my list of things that I might go through. Of course, we always start with diet. And we do have several diets that would be appropriate for a cat with kidney disease. We would supplement cobalamin, like I talked about. That patient might need steroids. They might even need a heavier immunosuppressive medication like chlorambucil. And then, of course, the supportive care. Anti-nausea medications, appetite-stimulating medications, we very commonly use in these patients. I don't want to go into diet options in detail, but just so you know, we do have some diet formulations on my website, my kidney disease website. These are not going to be the same formulations that you have in your country, but the point is to show how we could actually have diet choices that are appropriate for both kidney disease and for GI disease. And so we actually have a lot of options that we could give to that caregiver. But let's talk a little bit more about that gut-kidney axis and what it really means then from the kidney side. When you start to have kidney disease, what is it doing to the gut and how is that abnormal? And so one of the big things here is actually there are changes to the intestinal barrier itself in chronic kidney disease. So on the left hand of the slide, you'll see the healthy gut barrier. And you have tight junctions that hold those cells together and they don't let things absorb into the body. And on the right-hand side, you see this mess of different things that are translocating and absorbing across the intestinal barrier. Those include toxins, inflammatory mediators, etc. We have this leaky gut associated with kidney disease, and this is where we start to get huge problems. Dysbiosis, absorption of uremic toxins, etc. So this intestinal barrier is actually really important to systemic health, not just the gut, and actually not just the kidney, but the entire health of the patient. So it's something to think about. What do we know in cats? Well, in cats, we know that we do actually have dysbiosis associated with chronic kidney disease. This is something that we studied as part of Stacy Stummer's PhD project, actually with Dr. Lappin and myself when I was at Colorado State. Yep, Stacy did a great job looking at dysbiosis and the abnormalities that happen when you have both kidney disease and GI disease. And then when you have just kidney disease alone, you develop all these abnormalities in your gut. So we learned not only that cats have dysbiosis in their intestinal microbiome, but that also that they have increased uremic toxins. And I will say, uremic toxins is not something that we normally think about when we think about clinical practice. We can't really measure them except for creatinine and BUN. Those are the two most well-known uremic toxins. But actually, there's 146 other uremic toxins that we don't measure on our blood panel. Those are just simply substances that build up in the bloodstream when you have decreased kidney function. So as the kidney disease worsens, you have more and more of these toxins that build up in the bloodstream. And many of them, unfortunately, are actually quite bad for the body. And we're going to concentrate on uremic toxins like indoxyl sulfate. This is what we call a gut-derived uremic toxin, and this is where that relationship between the gut and the kidney is really important. It's produced in the colon as a result of protein fermentation. So if there's one thing that I want you to remember about this, again, it's that colon piece and the protein fermentation. The fact that it comes from protein, this particular gut-derived uremic toxin is very important when we think about management of our patients. And unfortunately, the other thing that happens is when you have dysbiosis, you have bacteria that are more likely to produce these uremic toxins. So what does this look like? Well, if you look at the gut on the bottom here, what we actually see is that we have dietary protein that comes into the body. It is those amino acids like tryptophan, indole, etc. They're broken down, the tryptophan, the amino acids, is broken down by the bacteria into indole. And that indole is what we call a precursor to a uremic toxin. It's absorbed into the body, and in the liver, it's sulfated into indoxyl sulfate. Now, unfortunately, once you sulfate that, you cannot get it out of the body any other way than through the kidney. And that's where we get into trouble, is with decreased kidney function, you're stuck. Those indoles and that indoxyl sulfate starts to build up in the body. And again, it's one of very many of these toxins that do that. When we look at what we know in cats with chronic kidney disease, we do see that uremic toxins increase with iris stage. And very importantly, even in stage 2 cats, you have significantly increased uremic toxins. So I don't think we give these cats enough credit for feeling poorly associated with their disease. They already have buildup of toxins in their bloodstream. What do we know about those uremic toxins? Well, cats who progress actually have higher indoxyl sulfate concentrations. So it's tied to progression, for sure. And then the other thing that we know is that indoxyl sulfate and other uremic toxins have really deleterious effects on the body. They're just evil. You don't want these substances building up in your bloodstream. I'm not going to go through this list of different things. This is just here to show you there are so many different articles on this describing how detrimental these substances are. So it is definitely something to be concerned about. And the big question is, what can you as a clinician do about it? So how do we target uremic toxins? Well, there's a number of different ways, actually. This is where the clinical practicality comes in. What can we do for our patients in the hospital? Even though I can't right now measure these toxins, these other ones than creatinine, I could still be doing things to help these patients. So we'll talk about dietary modification, fiber and prebiotics, probiotics, adsorbents, and then also lastly, addressing constipation, which actually is a big part for me. Jody mentioned this as well, and studying constipation and how we know it's detrimental for our patients. Why is there so much information on uremic toxins? Well, it's because they're actually poorly cleared by conventional dialysis. So even in humans, it's a huge problem. And that's why there's so many studies in rodents and humans on uremic toxins and what we can do about them. So let's talk a little bit about dietary modification. And the big part here that I remember is that this is a story about protein, and that protein levels in the food do influence toxins like indoxyl sulfate. There are a couple of studies that show us that indoxyl sulfate concentrations are higher when you eat a higher protein diet. And there's one study in normal cats that shows a little bit of an increase in those toxins when the higher protein diet is fed. Additionally, we do have a little bit of information in early stage kidney disease cats, so IRIS stage 1 cats. And here again, this study showed that there was a correlation between the protein levels in the diet and those uremic toxins. But we don't actually have a lot of data on what happens with diet in later stage kidney disease. But this is the whole reason why renal therapeutic diets were originally developed to be a little bit lower in protein so that they would not cause this increase in uremic toxins. So this is a really interesting area to be studying, and we definitely need more information. This is really important to discover more information for cats, though, because it's a delicate balance. Cats are obligate carnivores, and muscle mass is very important. Protein, of course, supports muscle mass, right? And those cats need their amino acids. So what is the balance here between muscle mass and supporting muscle mass, and then not actually developing too many uremic toxins and other toxic products that build up in the bloodstream? What do we go about doing that? The other problem that we see in our chronic kidney disease patients is that they get very muscle wasted, especially as disease progresses, right? This is not a surprise to anyone. As much as we try to really work hard on their calories and give them appetite stimulants, etc., we're always fighting this muscle wasting that happens associated with kidney disease. The other problem that we do see with these cats is amino acid deficiencies. So this is what this looks like. In both cats and dogs, we've actually studied amino acid deficiencies. There's been a group that looks at dogs. We've looked at cats as well. And what we see is that even though the cats are eating, they do have serum deficiencies in amino acids. So somehow that nutrition is actually not getting into their body. And I would highlight tryptophan actually in terms of what happens. Because tryptophan is the precursor to the uremic toxin indoxyl sulfate. But somehow, if you look at this graph, tryptophan is actually decreased. That amino acid is decreased and deficient in cats with kidney disease. So we have this problem where, in fact, they're eating, they develop uremic toxins, but they're not getting the right substances absorbed into their body. So why is that happening? That's the big question. We have a little bit of data in people to guide us in that regard when it comes to thinking about this. So in humans who have kidney disease, they actually have a decreased ability to absorb amino acids, just again, because of the disease that's happening, probably because some of these abnormalities in the gut barrier. And this is a phenomenon that we actually very poorly understand. But there is some data out there to show, even though you're eating, you're actually not getting those amino acids that you want into the body. You're unable to uptake them from the gut. This is a concept that we refer to as protein malassimilation. So again, you're ingesting the protein, but unfortunately, because you're not absorbing it appropriately, it ends up going on down the gut to the colon, where it putrefies and it results in production of uremic toxins. And unfortunately, it's just kind of a bad scenario because at the same time, that patient is muscle wasted, it's not getting the amino acids that it needs, and amino acid deficiency is also clearly happening. So a big message here is that you will not necessarily help muscle mass by simply feeding more protein. The story is unfortunately not that simple. If you feed more protein, you might actually not help muscle mass, but you actually might make more uremic toxins and have all those deleterious effects. So what on earth do? We need to understand more about this, but what can you as a clinician do right now? Well, there was one very interesting study that looked at that and actually looked at amino acid supplementation specifically, not just protein, but amino acids for these patients. And these data suggested two very important things. First of all, the cats need to eat all of their calories. So it's a very important goal. All those things we talked about with appetite and how cats eat and their eating behaviors, those very much apply to kidney disease and making sure that we support their appetite, get the calories in. This study showed that if the cats didn't eat their calories, they actually would then lose weight and muscle mass. But the other really important piece that the study showed was that it was essential amino acid intake and not total protein that was correlated to lean body mass, or LBM, is how we correlate that. So that's important because it means that when you supplement diets with amino acids, and majority of our renal therapeutic diets are actually supplemented with amino acids. It's just not something you don't see it on the label, but that's part of what people put into a renal therapeutic diet is amino acid supplementation. That is a good strategy to support muscle mass in this patient population. So just an important thing to think about. What else could we possibly do? Again, thinking about the amino acid piece. Well, this article came out recently that it's hard to know exactly what all is in this particular supplement, but it does have amino acids in it. And here again, this is maybe a little bit of evidence that amino acid supplementation can be helpful for these patients, whereas the cats that did not get the supplement had some progression. So again, we're looking for evidence that amino acid supplementation might help, and this would fall into that category. Another really big category to discuss is prebiotics, probiotics, and fiber. And this, again, could be an entire lecture in itself. But I'm going to distill it down to the main parts here in just terms of thinking about how do I help the gut bacteria? What substances can I give to the gut bacteria to improve their health and to improve the health of the gut overall? So some of by putting prebiotics, probiotics, or different types of fiber into diet or feeding them as supplements, we can have very many beneficial effects. The problem is, especially for cats, the recent research has shown is that it's very specific what fiber or what prebiotic or probiotic source you actually feed. So we definitely need more research in this area to determine what would be the best strategy for our cats so that that can be implemented in a nutritional strategy. The next big category that I do want to talk about is absorbents, and thinking about how do we utilize absorbents. This is a strategy that has actually been around for a long time. And there have been absorbents out on the market in different countries for human medicine and humans with chronic kidney disease. So this is now technology that has become available for cats with chronic kidney disease, and it's based around carbon and carbon's ability to absorb things in the GI tract. So these are tiny little grains of carbon that are spherical, and it has pores inside that sphere that actually absorb those precursors of the uremic toxins right in the gut. And I'll show you what that looks like. So if we look at this schema, I talked about how nutrition comes down the gut, and tryptophan is then metabolized by the intestinal bacteria into something like indole. Well, if you're using an absorbent, that is where it is actually taken up and it's trapped in the gut. And then it's going to be defecated out. Right out the back end of the cat it goes. That prevents it then from being absorbed into the body and sulfated into the liver, where again, your only option is for it to be excreted by the kidney. So you're basically saving the workload on the kidney by using this type of absorbent supplement. And we would think that the beneficial effect of that long term would be good. And the question then is, well, what evidence do we have that this is the case? We have actually been studying this in our chronic kidney disease research program here for the last couple of years. We collaborated with our colleagues at the University of Georgia to look at this in a colony of cats with kidney disease. And when we gave those cats the adsorbent, we did see a decrease in their indoxyl sulfate concentrations. And if you look at this graph on the right-hand side here, SOC stands for standard of care, so they were not getting any adsorbent. We were just monitoring them over time. And then SID is once daily absorbent, and BID is twice daily absorbent. So over 3 different periods of time, we compared what happened compared to baseline when we gave absorbent, and we see a dose-dependent decrease in those uremic toxins, indoxyl sulfate, and also p-cressyl sulfate, the other big main gut-derived uremic toxin. So this is really important because it provides us with some evidence. Our study was only 2 months long, though, so it's short-term evidence of efficacy. The colleagues at the University of Munich have also done a 6-month study looking at absorbance, and this was presented as an abstract at ECVIM, and they also saw an improvement in those cats. They looked at they looked at client-owned cats with stage 2 and stage 3 chronic kidney disease, and they followed them up over a 6-month period. They did also see a significant decrease in indoxyl sulfate and some improvements in dysbiosis. And then most importantly, the control group did not do as well and suffered some weight loss and a little bit of a decreased hematocrit. So again, we have some evidence that giving a supplement like this might be beneficial. The big question we also ask is when? When should I give that type of supplement? And people ask me that question all the time, actually. Is it late stage? Do we use it in early stage? Again, I would go back to this graph where we show that for sure we have increased uremic toxins in late stage disease, but we also do have increased uremic toxins even in stage 2 disease. So it's very likely that instituting this type of therapy early could have a beneficial effect. And then really interestingly enough, it could even be that uremic toxins are a hallmark of the development of chronic kidney disease. Just recently, this paper came out looking at uremic toxins and how they changed even before the onset of azotemic kidney disease. And to me, this is really fascinating because we talked about that gut barrier and how it changes. This is evidence to me that gut barrier is changing really early in the course of kidney disease. So we would typically think of it as a late disease effect, when in fact it could be something that's happening really even before we get azotemia in these patients. So they tracked these cats, they kind of followed them over time, and they had been taking toxin measurements all the while they were waiting to see if they would develop kidney disease or not. So 6 months prior to when they became acetemic, they already started to have increases in their uremic toxins. So this is really evidence that this whole gut-kidney problem starts quite early in kidney disease, and that, to me, we should be thinking about what we do about it and how we treat these patients. And for the last part of my section, I want to talk about constipation. Again, this has been a big goal for us, thinking about this therapeutically, but then also understanding what it means for our patients. It's something that I've always been curious about because, again, when you look at this particular radiograph, this is a cat with kidney disease that got a radiograph because it was vomiting. So we were just generally doing a radiograph. But this cat was a little bit dehydrated. She was not doing well at that moment. And you can see she actually has quite a bit of a buildup of feces in her colon. She was actually not having problems defecating, but that feces has been sitting in that colon longer than it should have. And if you remember, I said that this is a problem in the colon, and this is where uremic toxins are made. It makes perfect sense that if you have feces sitting in the colon, you have more of a chance to actually form and absorb uremic toxins. Not only that, but we now have evidence that constipation is a huge quality of life issue for cats with chronic kidney disease, so it's probably a pretty important goal for them. And I'll show you a little bit more about what evidence we currently have associated with constipation. I was really delighted when this particular article came out because it absolutely substantiates my clinical experience. Here, they looked at an emergency room setting to say that cats with kidney disease were more likely to present for constipation. And so that's really important because this is when the cats get into such a crisis that they actually have to go to the emergency room. And no cat likes the emergency room, right? Not a fun place for cats at all. So I would like to prevent my feline patients from going to the emergency room. So what can we do about that? Well, can we identify constipation earlier? That would be my goal. First, we have to ask the question, though, how do we actually identify constipation? What does that look like? So what am I doing when I assess my patient? Well, if it's very obvious, the caregiver will report to me that they're having problems in the litter box. They're in there and they're straining. They might cry out in the litter box, or heaven forbid, they vomit in the litter box. That's bad. That's like, that's what I would call overt constipation. And they're really struggling. That must be very uncomfortable for that patient. What I would like is to actually identify problems with decreased defecation before we get to that point. So what can we do? Well, ask about a fecal score. We have a fecal score chart, and we take it into the room with every appointment, and we ask that caregiver to tell us on a scale of 1, depending on what score you're using, 5 or 9, etc. What does it look like? 7, 1, 2, 3. Show them a picture. They don't know if you just ask them what is normal and is what abnormal. They need pictures in order to point at the picture. So that's a really useful tool to get additional information. However, cats can be sneaky, and maybe the caregiver actually hasn't seen where they're defecating, or they have more than one cat and they're not sure whose poop is whose, right, in the litter box. What do I do in terms of my physical exam? When I palpate that cat's abdomen, I feel the feces in the colon. And this is my biggest exam tip for you, is that cat is probably pretty skinny because it has kidney disease. I actually locate the colon and I kind of squeeze very gently that feces in the colon. It should not be hard and like tiny little rocks. It should be easily compressible. And when I feel that, I then will ask the caregiver more questions about what's happening at home. So I do think it's important to gather that information. So we might see things like this as well. They might leave like little pooplets around the house. This is a sign that they're struggling. So these are all things that I really think about. And that could be decreased defecation or problems with defecation. We have also tried to look into actually objectively measuring defecation frequency in cats with kidney disease. And the very first thing we did was a survey. We actually, under the idea that the caregiver doesn't actually know what happens in the litter box, we asked them to scoop it every day and to tell us what they found. So for 7 days, they would scoop the box and they would record exactly how many urinations and defecations there were. And we asked both caregivers with normal cats and caregivers with chronic kidney disease cats to fill out this survey. What we discovered was that, yes, often it was that cats with kidney disease would not defecate on a daily basis. Normal cats, daily, even twice a day in some cases. But that kidney disease cat, they would have days where they would miss. It would often be every other day. But of course, we're relying on what the caregiver says for this information. And so what can we do to even more objectively take a look at this? So we also did a defecation study where we looked using litter box monitors, and we were able to show, again here, that we had a decrease in defecation. So what did that look like? Well, these are litter box monitors that go right under the existing litter box, and they track urination and defecation. And they also track the cat's weight, which is really, really helpful. So one of our students, one of our veterinary students, did this as a summer project. And actually, if you're interested in this study, it was just released online this morning. So it should be available for people to take a look at. I was very excited to get that email. But what it shows is that we looked at healthy cats and cats with chronic kidney disease, and we definitely see, when measured by this litter box monitor, a decrease in defecation. So we looked at the cats over the course of a month at 14, 21, and 30 days. And basically, about a third of the time, they do not defecate. They miss a day. Whereas again, those healthy cats are going every single day. What does this look like on the device? Well, it's really pretty great. It gives you a readout on a daily basis of what's happening. So on the left-hand side, we have our normal cat, and on the right-hand side, we have our typical cat with chronic kidney disease. And the little brown dots are defecation, and the little yellow dots are urination. Makes perfect sense, right? So you can see from this image, this is right from the app that comes with the device, that you have missed days when you're a chronic kidney disease cat. So again, that means that there's feces that's sitting around in the colon. That makes perfect sense to me when I think about why this might be happening in kidney disease. So what are those factors? Why is this so common in chronic kidney disease? Well, there's two big things. Here's the two big things clinically that I want you to think about: hydration and also potassium. We have to know what the hydration status is of the patient, and we have to know what the potassium status of the patient is. If they're dry and if they're hypokalemic, they're much more likely to be constipated. And guess what? You can fix those things, right? Those are things that we can have an effect on, and we can improve their defecation as a result. So those are the very first two things that we target. Also, if you're utilizing a phosphate binder, those can result in some constipation as well. And then, going back to the gut-kidney axis, guess what? Those uremic toxins that come from the colon when the feces are sitting there, they actually decrease GI motility. So it's a cyclic problem that happens. What does that look like? Well, in humans, there's a study that shows that when you have harder feces and you have problems with constipation, yes, you have higher uremic toxins. And then unfortunately, again, that feeds back on itself and you get that decrease in GI motility. So I'm just going to finish up with some information about what we do in terms of constipation. This is the part that to take home and think about. First, identify that you have a problem. And then secondly, for constipation, what do we normally do about it? So the two big things that I mentioned were hydration and hypokalemia. Those are huge in chronic kidney disease. So we think about all the different ways that we can address hydration when it comes to chronic kidney disease. What are the water sources in the home? Are they clean? Are they accessible to the patient? What about nutrient-rich water, which would be something that has a higher viscosity for the patient, and they will be more likely to drink more of that nutrient-rich water and help with their hydration? We also commonly have people that give subcutaneous fluids at home to help with hydration. And this is particularly helpful when the cat will not, drink enough water to help itself. This, for me, is also a huge communication point for caregivers because they very commonly see that the cat drinks a lot and it urinates a lot, and for some reason, they then think that this means the cat is hydrated. But that's not at all the case when you have kidney disease. They're actually dehydrated. So we show caregivers how to monitor hydration with a skin tent to give us that information. We really talk to them about water sources and different ways that we could supplement hydration. Second on the list, again, as I said, is hypokalemia. If that is there, I really want to address hypokalemia. So this is something that I always check for, and it's going to be one of the very important medications that I would give that patient, especially if they are struggling with constipation. From the standpoint of the kidney, those two things come for me first, and that's very different than a cat with constipation who's a young cat with constipation and doesn't have kidney disease. These are old cats, and they will have arthritis, so think about addressing their arthritis in any way that you can. And then lastly, once I have addressed those other things, or at least concurrently, that's when I will use the osmotic stool softeners. That's where I will then also reach for the pro-motility agents. We're very likely to need those things too, but they're not going to work well in a patient that is dehydrated and has low potassium. So those two things are really important when you have that disease. And then just to bring everything home all together, I would encourage you again to think about this connection between the gut and the kidney and how therapeutically we can have targets where you could clinically address this relationship between the two. So think about chronic enteropathy or underlying GI disease. Treat that chronic enteropathy. Make sure that you know that's happening for the patient. Think about how we could intervene with dietary therapy, utilizing absorbents, and last but not least, address constipation and make sure that we are aware that that's happening if they have decreased defecation frequency and get that material out of the colon. We hope that that would have a good impact both on the quality of life for the patient and also for those uremic toxins. So thank you so much for your attention. Again, here's that QR code. We'd be happy to address any questions.